Okay, here's a question from Stephanie. How often do people with musculoskeletal ailments have to come for chiropractic adjustments, and for how long should they keep coming back? Well, that's a good question. I've heard people say that people have told them they won't go to a chiropractor because if you go to a chiropractor, you have to go forever, which is not true. In my office and in most chiropractic offices, there are 3 levels of care. The first is acute care. So a person comes in, they've got pain, neck pain, back pain, sciatica, whatever. And that can take, depending on how long the problem's been there, the condition of the patient, age of the patient, there's a lot of different factors there. But it could take, a young person comes in, I tweak my back at the gym, may take a visit, maybe 2 visits, and they're done. Now, if they want to go further with this, we'll do the examination, part of the motion palpation I showed you, the other things. If there are problems that I see, underlying musculoskeletal problems, I'll bring them up, I'll explain it to the patient. And then the patient gets to choose. Do you want to come for what we call corrective care? Now, corrective care can take, depending on the patient, depending on what's going on with the patient, it can take a few weeks, it can take months, it can take more than a year. So what we're trying to do there is get the spine as functional as possible, to get those red beads that I talk about where the joint is not functioning properly, to get it moving more like this. Now a person comes in, he or she is in the 20s, early 30s. It's not going to take a really long time. Person comes in, person's in 60s or 70s, we're not going to get this to be normal, because a person will go through degenerative changes. Now, if the structure changes, the function can't be there, because structure follows function, function then follows structure. So let's take a look. Here's normal. Textbook normal is a lumbar spine. It would be true also for the cervical spine, the middle back too. 2 bones, there's a nice thick disc in between them. Now here's the joint back here. Now these are attached with muscles. They're layers of muscles and ligaments holding them together, stabilizing them, moving them. So everything's supposed to be moving perfectly functionally, and we try to get that joint to move better and to move normally. Once it's moving normally, the corrective care phase is done. Now, if you're going to have a joint where the disc is thinner, because it's been wearing down, I'll see a lot of this in a person maybe in the even late 30s in the lower back. You'll see 1 or 2 areas that are like this. And then we'll see the next phase, we'll actually see the bone starting to remodel. In other words, the disc is thinner, the joint's less stable, you start to see bone spurs occurring at the top and the bottom. That can impact the nerve root, and you can get sciatica, you can get numbness in the hands, you start to get weakness. Also, you can get areas of the body that you wouldn't relate to the spine that aren't functioning as well as they should. So that's the final phase, is this where there's just about no disc at all. Generally, it gets to this point, these bones can actually fuse. And I see this in patients who are quite old, 70s, 80s. But the thing is, I'll see a person who's in his or her 80s, maybe 70s. They'll have some areas that are like this, but they'll still have some areas that are like this. So it tells you that it's not all about aging. It has to do with how you use your body, your posture, the way your body functions, various things that happen to you, and how long you've had those motion unit fixations that don't allow for normal motion, which eventually causes degenerative changes in the cartilage. So obviously it's not all aging. And with that in mind, then we have the third phase, which is called maintenance care. I've had patients who've come to see me several times a year for many, many years, and they find that the benefits that they get from that, they compare themselves a lot of times to their neighbors who are their age, and they're generally more functional, they're more mobile, they have more energy, etc. Now, again, this is one of these things that is kind of vague. There needs to be a huge study on that, and there has not been a huge study on that. But I've seen it. I've seen it in my practice, and patients are convinced that this is a major part of their good health, their good health regimen. Eating properly, drinking pure water, exercising on a regular basis, and getting their spines mobilized to make sure that everything's functioning as well as it should. So we have those 3 levels of care, and it's up to the patient which one they want. I give them the information, and the patient can do what they want with it.